Hi everyone, this is Dr.Geetha Nagasri, Neerukonda, Senior Surgical Oncologist at Care Hospital, High-Tech City. Today I am going to talk about ovarian cancers. As everybody knows, every woman has two ovaries. So ovarian cancer is one of the most common gynecological cancer in women. And unfortunately, 70% of the ovarian cancers in women are diagnosed in late stages only, because there is no effective screening for ovarian cancer like breast cancer or cervical cancer. Other thing is, the symptoms in ovarian cancers are very subtle, like bladder and bowel disturbances, not able to take food properly. If they eat small amount, that they feel early satiety, that is called, and some gastritis like symptoms, and some dyspepsia like thing. They have all these subtle symptoms which they consider it as because of the other things, like some urinary infection, some otherwise some gastritis. Women think like that till the end. So most of the more than 70 to 80% of ovarian cancers are diagnosed in the very late stages, third or fourth stage. That is the reason the prognosis in ovarian cancer is little bit not good. After so much of advance also, still the 5-year survival rate in ovarian cancer is only 40%. Main reason being the late diagnosis, because it is diagnosed in only third stage. So what are the risk factors for ovarian cancer? Then again, the risk factors for ovarian cancer is same thing. And one thing is genetic risk is 5 to 10% of ovarian cancers are hereditary. It passes from mothers or grandmothers or mother sisters, or if we have ovarian other people in the that gene will run in the family. The gene is known as BRCA gene, breast and ovarian cancer gene. If it is there in the family members, other family members, better to get the test done, so that prophylactic surgeries, like after finishing the family, we can remove both ovaries, so that this ovarian cancer can be prevented. Once the ovarian cancer happens, what to do? Once the ovarian cancer, the main treatment being the surgery and chemotherapy. The surgery involves, actually usually it will present it in third stage, that it is spread to all the organs like omentum, that it won't stay there, it will spread to the peritoneum, above the liver, the undersurface of the diaphragm and all. Surgery is a little complicated surgery, it takes long hours. We had to remove everything: ovaries, uterus, peritoneum, undersurface of the diaphragm, peritoneum, wherever nodes, pelvic and para-aortic nodes, the nodes along the big vessels. We had to remove all those things. And sometimes recently some advancement is there, that hyperthermic intraperitoneal chemotherapy. After removing everything, we put the heated chemotherapy, we circulate for 90 minutes in the abdomen, so that after removing all tumor cells, any small microscopic cells will be taken care. And chemotherapy usually first 6 cycles they give. Sometimes if it's a very advanced stage, we feel that if we can't complete the surgery to the adequate optimal cytoreduction, we can't do, we give first chemotherapy 3 cycles and go for surgery, and then complete the other 3 cycles. But primary surgery, upfront surgery is always a gold standard. If you can do the upfront surgery, remove everything, nothing like that. But if you have that when patient condition is not good, or very bulk of the disease there in the upper abdomen where we can't do proper cytoreduction, better to go for chemotherapy, reduce the bulk and go for the surgery. And after surgery and chemotherapy is completed, we follow up the patient every 3 months with CA-125 and ultrasound abdomen. Usually if CA-125 is again raised, means that disease recurrence is there, we have to give again chemotherapy. If it is in 6 months or more than 6 months, depending on that, drugs we change, chemotherapy drugs. Because once it is stage 3, ovarian cancer is nothing like a permanent cure, it is a prolongation of survival. So we we usually 70 to 80% will recur. When the recurrence happen, again chemotherapy will be given. If the recurrence disease free interval is very long time and it is recurrence is in one particular area, sometimes we can go for the secondary again surgery also. So we follow up with the CA-125 ultrasound abdomen, and actually usually the survival rate 5 years, as I told, it is 40, even it is 40%. So the key being the early diagnosis. Women should not neglect any subtle symptoms like as I told, like any uneasiness in the stomach, any discomfort, any gastritis like symptom, or any like if you eat weight loss or bladder bowel symptoms, anything women should report to the doctor as early as possible. Not only cancer, sometimes ovarian cysts also will be there, the benign thing, like this is like benign, borderline and malignant, 3 types will be there. Sometimes it will be benign and borderline, that won't cause any harm, but surgery to be done and that cyst to be removed. So women should not neglect themselves and approach the doctor in a appropriate time. Thank you.